Lucy Alvarez, and I'm interested in becoming an RRT, a registered respiratory therapist, and I've been given the opportunity to job shadow a lead therapist at the NBRC Medical Center, and I'm so excited.
Hello. Hi, good morning, Lucy. I'm Kayla, and I will be mentoring you today. I just received an order for one of our pulmonologists to evaluate a patient for potential discharge. And since you have completed the HIPAA training and the requirements from HR, you've been approved to review the patient's chart with me. So let's take a look at her medical record before we go see her, okay?
Okay.
All right. Okay, so I always begin by reviewing admission information. It contains a SOAP that gives me a lot of information about the patient. The letters SOAP represent subjective, objective, assessment, and plan. So we'll take a look at these. They're used to assess the patient and just to give information about what the patient's here for and history of the patient. So she is well known in our department. Her name is Miss Tubbs, and she is a 54-year-old African-American female. She was admitted a week ago for COPD exacerbation. And in the SOAP, it says the subjective is, I feel like I'm smothering, I cannot breathe. Her vitals in her objective is heart rate of 138. Her respiratory rate is high with it being at 28. Her blood pressure is 148/98. And her temp is a little high at 100.8. It also says that she has accessory muscle usage and hyperresonant percussion note, diminished breath sounds with end expiratory wheezes. And her general appearance, she has no digital clubbing. She has an increased AP diameter, so she has the barrel chest. Her chest x-ray does show some lower lung infiltrates and hyperinflation with flattened diaphragm, which is pretty normal for a COPD patient. And her PFTs showed a decreased FEV1 FVC ratio. And that's at 55% predicted. So that's well below the 80%. On room air, her ABG showed a 7.26 pH, and her CO2 was up at 78. And her PO2 was 41. So whenever they did an assessment, she's having bronchospasms, a pulmonary hyperinflation, acute ventilatory failure on top of chronic. So that is the exacerbation that she's having. And then the P is the plan. So they're going to begin protocols for ventilator management, oxygen therapy, and aerosol therapy. And they will initiate non-invasive positive pressure ventilation. So they'll do a BiPAP with IPAP at 10, EPAP at 5, at 24% of FiO2, and they're going to titrate that to maintain the SpO2 at 85 to 88. They're going to do albuterol at 0.5 milliliters and mix with the 3 mLs of normal saline. Okay. And it looks like they're going to obtain a sputum culture too. Okay, so right now she appears to be in moderate amount of distress just based off of her SOAP note when she arrived. So we're going to look at her vital signs after she had been on the BiPAP for 30 minutes, and I'll explain the non-invasive pressure to you later. But here are some of her PFT results from the clinical visit she had earlier this month. So even earlier this month, it was still showing that she wasn't reaching the minimum of 80% of predicted. Her volumes were low. Her forced vital capacity was less than it or more than it should have been, which is pretty, post. So this will show post-dilator, bronchodilator, and the pre to see if there's a difference or a change. She had very little to no change at all with the post-bronchodilator. So, as you know, the PFT is used to help diagnose the COPD, and this is just textbook for her for COPD diagnosis. So we'll go and take a look at her and see how she's doing.